an interview with Professor Robin Ali on gene therapy for sight loss.
I'm Robin Ali. I'm Professor of Human Molecular Genetics at UCL Institute of Ophthalmology, and I'm a theme leader in genetics at Moorfields Eye Hospital. And I head the Moorfields and Institute of Ophthalmology gene therapy program. We're developing a program of clinical trials, and we aim to carry out trials for several different forms of inherited retinopathy over the next 5 years.
How does gene therapy work? How do you deliver genes to the eye?
In order to deliver our gene to the retina, we use a so-called viral vector, which is an engineered virus, and we engineer the virus to make it safe and to carry the therapeutic gene to the cell that we want to deliver it to. In most cases, this is a photoreceptor cell or retinal pigment epithelium cell. And we deliver the engineered virus by a surgical procedure that involves injecting the vectors, the engineered virus, into the back of the eye, into the retina, so as to cause a temporary retinal detachment, which resolves within a day or so. There's inevitably some worsening of vision as the retina reattaches, but so far we've seen that the procedure is safe, and the patients recover well.
How do you decide who takes part in your clinical trials?
So we choose our subjects for the clinical trials very carefully. It's important to remember that these are experiments in people, they're not treatments, and we design our trials in such a way as to determine whether these novel approaches are safe and effective. And so when considering whether you might be eligible for a trial, it's important to know what genetic defect you have, and then there are other inclusion criteria that may apply in terms of age. We would include a range of ages, starting with the oldest subjects for safety reasons, and we would often start our trials with subjects who have advanced vision loss. It's unlikely if subjects have lost almost all their photoreceptors that they will be eligible for inclusion in the trial, because gene therapy depends on delivery of genes to cells that are still present and available to be treated. And so there has to be some residual site in order to participate in such a trial.
Can you update us on the RPE65 trial? What's happened to the vision of the patients who participated?
So we've enrolled 12 subjects in this, which is our first trial. And of the 12 subjects, 6 have experienced an improvement in retinal sensitivity and an improvement in night vision. And I think that's quite remarkable for the very first trial of gene therapy for inherited retinal degeneration. There's a lot more work to be done, but to see such benefit in patients has been very encouraging.
How do clinical trials elsewhere benefit the field of eye gene therapy?
It is a field that benefits from international collaboration and cooperation. And so development in one gene therapy has a beneficial effect and drives forwards the development of gene therapy for other conditions.
Given the success of your first clinical trial, where next for eye gene therapy?
So we're at a very exciting stage in which we're now moving from proof of concept studies in mice to clinical trials in people. We know these therapies can work effectively in animals, and we're now setting up clinical trials to see how effective they are in people. But we must go through this next stage before we're at the point at which we have licensed products that may be available for patients in a routine clinical setting. And I think it may be 4 years before we see the first licensed product, perhaps for RP65, which is our first trial. But if we can establish just one licensed product, it will be a huge benefit for the whole field, and we should see a number of products coming close behind.